Have you ever tidied up your desk and casually said, "Ugh, I'm so OCD"? We all hear that phrase, but the feeling of liking things neat is just worlds away from the reality of obsessive compulsive disorder. So today, we're going to get past those stereotypes and really get to the heart of what this condition is all about.
Yep, this exact phrase. It gets thrown around all the time, right? It's become shorthand for being particular, for liking things tidy. But here's the thing. When we use it so casually, we're accidentally flattening this really complex and often painful medical condition into just a simple personality quirk.
And this right here, this shows you just how massive that disconnect is. On one side, you've got this idea that it's just a funny quirk. But the clinical reality, it's a serious medical condition that causes real, significant distress and can totally upend someone's daily life. They're not even in the same ballpark.
So here's our game plan. First, we're going to bust the stereotypes. Then, we'll map out the OCD cycle itself. After that, we'll peek at the science, look at the very real pathways to treatment, which is super important, and finally, talk about how we can all be better allies.
Okay, first up, let's get beyond the stereotype and break down what OCD really is. So OCD has two main parts. The first one, obsessions. And the key words here, the ones you really got to focus on, are unwanted and intrusive. These are not your everyday worries. This is different. These are persistent, disturbing thoughts that feel like they're invading your brain against your will.
And these obsessions can look like a lot of different things. It might be this crippling, deep-seated fear of germs, or a constant nagging worry that something awful is about to happen, or that overwhelming need for things to be perfectly aligned, just right. It's so much more intense than just a simple preference.
And all of that anxiety from the obsessions bleeds directly to the second part, compulsions. Okay, think of it like this. The obsession is a fire alarm that's just blaring in your head nonstop. The compulsion is that frantic, desperate need to do something, anything to make that alarm shut up, even for a minute.
So if that obsessive fear is about germs, the compulsion might be washing your hands until they're cracked and raw. If that obsessive doubt is about locking the front door, the compulsion is to check it and then check it again and again. The action is a direct attempt to neutralize that terrifying thought.
And this is what's so cruel about OCD. A person who's going through this often has a part of their brain that knows. It's screaming that this fear doesn't make sense, that the door is locked, but the anxiety is just so powerful, so overwhelming, that they feel completely powerless to stop the compulsion. It's like being trapped by your own mind.
So now let's dig into how this builds into what's called the OCD cycle. It's this relentless loop of fear and very, very temporary relief. This really lays out that vicious cycle perfectly. It all starts with that intrusive thought, right? The obsession. That immediately sparks this huge wave of anxiety. To put out that fire, the person performs a compulsion. And for a second, there's relief, but it never lasts. That cycle is already winding back up to start all over again. And being stuck on that hamster wheel has massive, real-world consequences. It can just eat up hours of someone's day, making them late for everything. It can make them avoid places or people they love, which leads to so much shame and isolation. And honestly, the sheer mental energy it takes makes it almost impossible to concentrate on anything else. So, what is actually going on here? Why does this happen? Let's get into our third section, the science behind OCD. You might be wondering what causes OCD. And well, it's not one single thing. It's actually a super complex mix of different factors. You've got genetics playing a role, the way different parts of the brain talk to each other, you've got environmental factors, and sometimes a really stressful or traumatic event can act as a trigger. It's kind of like a perfect storm. Okay, I want to pivot to something incredibly important and honestly hopeful. If you're struggling with this or you know someone who is, please hear this loud and clear. There is help. There are really effective treatments out there that can help people break free from this cycle.
And a really great news is that OCD is very treatable. The gold standard approaches usually involve a few key things. There are specific kinds of therapy, like cognitive behavioral therapy and something called ERP, which we'll talk about. Sometimes medication can be a huge help too, along with things like good sleep and exercise.
Let's talk about ERP for just a second, because it's a real game changer. Think of it like this. You're learning to swim. First, you just dip your toes in. Then you go into the shallow end. You slowly, gradually expose yourself to the thing you're afraid of. That's the exposure. At the same time, you actively resist the urge to do the compulsion. That's the response prevention. Over time, it actually retrains your brain to learn that the anxiety will pass on its own, without the ritual.
It's hard work, but it's so powerful. And it is absolutely critical to know that if you or anyone you know is in a crisis, help is available right now. In the U.S., you can call or text 988 anytime to connect with the Suicide and Crisis Lifeline. Seriously, please don't ever hesitate to make that call.
Okay, for our last section, let's bring it back to us. What is our role in all of this? How can we be a genuine, helpful ally to someone who's navigating life with OCD?
This slide is basically your playbook. On the do side, listen without judging. Be patient. Recovery isn't a straight line, and gently encourage them to seek professional help. Now, the don't side is just as important. Don't make jokes about it. And this is a big one. Don't offer constant reassurance or help them with their compulsions. I know it feels like you're helping, but it actually just feeds the OCD cycle.
So if you remember one thing from this section, let it be this. Your job isn't to fix them or their compulsions. Your job is to be there, to be a source of understanding and support while they get the professional help they need to walk their own path to recovery.
All right, let's do a super quick recap of the big takeaways. Number 1, OCD is a real and totally treatable medical condition. It's not a personality quirk. 2, it's all about that powerful cycle of obsessions and compulsions. 3, and this is the best part, treatments like ERP really work. And finally for us, understanding and patience are absolutely key.
So I'll just leave you with this question. I really hope this explainer has shed some light on what OCD truly is. If you're out there struggling, please know you are not alone. There's so much hope and you can get better. And for everyone else, let's be that source of compassion. Let's retire the stereotype for good and build a community that's just a little more understanding for everyone.